Assalamualaikum warahmatullahi wabarakatuh. Greetings to all of you. It is an honor for me to be here to present my work. Thank you for the committee for having me. Let me introduce myself. My name is Feranindhya Agiananda. I'm a psychiatrist and also a lecturer from Faculty of Medicine, Universitas Indonesia, Dr. Cipto Mangunkusumo, National Central General Hospital, Jakarta, Indonesia. Today, I would like to present my research regarding the effectiveness of online-based psychiatric assistance in reducing anxiety and depression in COVID-19 patients treated in the isolation room. As we know, the ongoing COVID-19 pandemic is depicted by the rapid increases of confirmed cases and deaths, and subsequently, government strict policy to prevent the spread of virus, such as physical distancing and lockdown policy, which limit our physical and social activities, work, as well as to access to healthcare, has caused many dreadful consequences in our lives. First, in education, economic, and social aspect, we are forced to shift many of our activities from face-to-face to online platforms. School and workplaces were closed, and many employees were laid off, which lead to financial uncertainty. Second, burden in healthcare aspect. As we can see, we all face shortage of hospital resources and inadequate number of healthcare providers. Even worse, healthcare providers are not only obliged to have the ability to provide consistent and high-quality care, but also have to triage treatment among critically ill patients. Third, mental health and well-being aspect. From recent study depicted that COVID-19 infection has led to the occurrence of anxiety as much as 42%, depression 40%, insomnia 31%, post-traumatic stress disorder 28%, obsessive-compulsive disorder 20%, substance abuse 13%, and suicidal thoughts 10.3%. As a case illustration, I would like to share two real cases that we found in our hospital. First, a 54-year-old man, COVID positive, came to ER department after slitting his throat as an attempted suicide because he cannot stand financial burden caused by this pandemic. This patient had no severe symptom of COVID infection, and after receiving treatment in the emergency room, he was hospitalized in the isolation room. Second case, a 30-year-old woman, after confirmed being positive of coronavirus infection with severe symptoms, was treated in our intensive care unit for 1 week. She developed psychological symptoms consistent with anxiety and insomnia, and the patient became restless and uncooperative, and very resistant to doctors and nurses. And even worse, she also had suicidal thoughts, and she said that she would rather die if she had to continue to be treated in the ICU. These two unfortunate cases have shown us how serious the impact of pandemic on one's mental health. The psychiatric assistant is needed while they are being treated in the isolation room. In order to find a proper treatment for patients who need psychiatric assistance in isolation room, we conducted a quasi-experimental study which been done in Dr. Cipto Mangunkusumo National General Hospital, Jakarta, Indonesia for the period of July to October 2020. The inclusion criteria were COVID-19 confirmed by SARS-CoV-2 RT-PCR test, age 18 to 59 years old, understand Bahasa Indonesia, fully conscious with Glasgow Coma Scale of 15, and screen positive for psychological symptom by self-reporting questionnaire of SRQ score more than 5. And next, we perform an intervention to the participant with series of supportive psychotherapy by a consultant psychiatrist. The psychotherapy consisted of 5 sessions lasting 30 to 45 minutes each and was given through WhatsApp video calls. Participants are compelled to turn on their video during the sessions all the time. Instruments that we are used were demographic questionnaire, SRQ-20 for psychological symptom screen, Hamilton Anxiety Rating Scale, and Hamilton Depression Rating Scale. Lastly, the data collected was analyzed using SPSS version 25.0 to assess the demographic characteristic and the change of anxiety and depression symptom pre and post intervention. Now, I would like to take your attention to this little orange frame square here, which highlights the majority numbers from the demographic table. Our respondents were mostly female, 64.5%, adult, 67.8%, Javanese, 67.7%, Muslim, 87%, college graduate, 77.4%, and married, 61.3%. And have a look to the charts on the right side. Here you can see pre and post intervention result both for anxiety and depression. This is no coincidence, as both graphs for depression and anxiety has similar shown the decrease of anxiety or depression score after given intervention. Prior to intervention, we found the baseline anxiety and depression symptoms were in mild range, around 54.8% and 77.4%. And after intervention, most respondents were in none or minimal range of anxiety depression, around 87.1% and 96.8%. Interestingly, out of 31 participants, 28 showed reduction of anxiety symptom, 27 showed reduction of depression symptom, and none of them showed deterioration of symptoms. For the discussion, the anxiety and depression symptoms found among study respondents reflect the wider trends of mental health problems in the COVID-19 pandemic. A study reported anxiety and depression are the most common mental disorder, followed by insomnia, post-traumatic stress disorder, obsessive-compulsive disorder, substance abuse, and suicidal ideation during this pandemic. Anxiety and depression are more prevalent in patient population compared to the general population, similar to this study. The finding of our study also show the need for robust psychiatric support for COVID-19 patients, especially those who are treated in the isolation wards. The restricted place to minimize risk of COVID-19 transmission have been a major barrier for the provision of psychotherapeutic services, which traditionally is delivered face-to-face. A study conducted by Ruward J. et al., which a great number of samples, around 1,500 respondents, showed a promising outcome that online psychotherapy was effective in reducing psychopathology in pre- and post-intervention, or even in 1 year after treatment follow-up. The use of technology in mental health, such as telepsychotherapy, can be an alternative solution in addressing patients' mental health issues and social distancing policies, particularly with advances in internet services and smartphones in this era to make it visible for patients. We know that psychotherapy session used to be done face-to-face, but now the advance of technology has simplified how we do online psychotherapy. One of the platforms that we can use is WhatsApp, which is already widely known and commonly used in Indonesia and many other countries. The virtual model of this study creates flexibility for both doctors and patients. Telepsychotherapy has gained interest as a feasible alternative. Previous study has confirmed that it is as effective as face-to-face delivery. For the conclusion, COVID-19 pandemic has highlighted the great importance of mental health services in this era. Telepsychotherapy is more preferred and feasible due to limited access to face-to-face mental health services in order to mitigate virus transmission. Telepsychotherapy is proven as effective in reducing psychopathology as direct psychotherapy in patients treated in isolation room. This is the end of my presentation. Thank you for your attention. I really hope my presentation widens our perspective. Stay safe and healthy. Assalamualaikum warahmatullahi wabarakatuh.